I'm Judy Zelina. This is the Millcreek Government Channel. Today on the program, we are going to be talking about training the geriatric healthcare workforce. And who better to talk about geriatric healthcare is Dr. James Lin. Dr. Lin is a DO. He is also the Vice President of Senior Services and Adult Living, and also the Director of LECOM's Institute for Successful Aging. And if that's not enough, Dr. Lin is also a clinical professor of geriatric medicine at LECOM. So again, who better to talk about geriatric health care than Dr. Lin? Thank you so much for joining us.
Thank you, Judy. I'm happy to be here and glad to be here.
Well, I'm really excited. We're going to be talking today about a grant that was recently received, LECOM recently received. But before we get into that, because it's really interesting, I mean, we're going to see some new avenues in geriatric health care here. But I'd like to talk a little bit about LECOM.
Sure.
They are so unique. They are so successful. You guys do so much more than just, just osteopathic medicine. You've expanded.
Correct. So an overview of our health system is recently, it used to be Millcreek Health System, and recently we have renamed our health system to LECOM Health. And under LECOM Health umbrella, Lake Erie College of Osteopathic Medicine is part of that. We also have Millcreek Community Hospital, and we also have Medical Associates of Erie, and then the Millcreek Manor, otherwise known as LECOM Senior Living Center. So the health system has grown over the years, and LECOM really has taken the leadership role in terms of developing not only in clinical services but also obviously education. So they have grown into medical school. We're the largest medical school in the country in terms of enrolling class.
Are you really?
Yes.
Right here in Erie?
Right. Well, we have 3 campuses.
Oh, okay.
One in Erie, one in Greensburg, Pennsylvania, and one in Bradenton, Florida. And we also have a pharmacy school that have 2 campuses, one in Erie and one in Bradenton. And the latest addition is also a dental school. So
Right.
We have the dental school located in Florida, but there is a dental clinic. People may have seen the sign recently that on West Grandview, it's our LECOM dental clinic. So those are our dental school faculty members, as well as our dental students, are providing care to our community for oral health. So over the last 10 years, the health system strategically had planned that geriatrics was going to be a focus for the health system, and because the leadership recognized how our demographics is going to change 10 years ago, and moving forward by the year 2030, we're going to have our population over 75 million Americans over the age of 65. And the old, which is 85 and above, are going to be the fastest growing segment in the population for the United States, as well as around the world, really.
Right.
But Pennsylvania is actually the 3rd largest state in terms of percentage of individual over the age of 65. And obviously Florida is another state that has a large population of geriatric individuals. So the health system wanted to take a leadership role in developing academic educational program, as well as provide the most superior geriatric clinical services. So since I started back in 2008, I finished my fellowship, and I started my job here, we have grown quite a bit, and we've grown rapidly. And it's because we have the support of the entire health system, backing us for all the programs that we're developing. And it takes us to today, we're able to be competitive and actually be awarded by HRSA the Geriatric Workforce Enhancement Program for $2.2 million over the next 3 years.
Wow.
And the federal government has recognized that there's an aging population, and it's going to be a big issue. But not only that, the bigger problem is that there's not enough geriatric workforce for all disciplines in healthcare. So it's not only physicians, pharmacists, dentists, but also nursing, therapy, social worker, and all the caregivers that need to be educated on the aging population for their loved ones. So the cost is going to be enormous in terms of utilization. So the federal government has recognized that we need to do something about that. So they have funded this grant, and they have identified the opportunity was 44 institutions in the country will get this grant. And we were lucky enough to be one of the 44 institutions.
Congratulations.
So we're up there with, the elites such as Johns Hopkins, Yale University, or Duke, and which is a remarkable thing considering LECOM is a relatively young institution, and traditionally these grants are awarded to these major institutions in the country. And we're really proud of that because it's sort of a testament to our board and our entire health system and organization, how they put their resources and effort behind developing the program. And we're able to be competitive because over the last 7 years, we have built the most comprehensive continuum of care, really in northwestern Pennsylvania, but not only that, I would argue that it's in the state because we have services that we have developed from a community-based preventive medicine point of view that we can talk about a little bit later, all the way through to end of life, where we just built a $42 million LECOM Senior Living Center that would take care of people that needs rehab as well as long-term care or end-of-life care. So it's really a remarkable thing that we have done in the last 8 years.
Well, I think it's remarkable, Doctor, that you have looked at the whole process. Starting to age and working your way towards end-of-life issues. So it is remarkable, and this grant is absolutely fantastic. As you were talking, something came to my mind. When I think of geriatric healthcare, I immediately think of nursing. That's it. I mean, right away I think of a nurse, someone who'll come in and take care of you. But you were talking about physical therapists, and it encompasses much more than just the nursing or physicians, correct?
Correct. So, what I do on a daily basis is, as a geriatrician, our goal is always to improve one's quality of life and also to maximize their function. And if you think about that basic philosophy of that thought, if you want to keep somebody who has good quality of life, you have to optimize their function. They have to be able to do what they like to do on a daily basis independently.
Okay.
So in order to achieve that, it really takes a whole team of individuals, especially if you're an individual who's 85 now that you have chronic disease, and now you're more frail and you're more weak, and how do we get you back to where you're functioning at the optimal level? And it really does take and require all these disciplines, not only therapists, but social worker, to really tell the patient or the family what resources there are. So there's a lot of expertise in that, and that's where we're lacking in our country in 2016, is that there's not enough faculty members to actually teach the new generation on how to take care of the elderly. But not only that, we have to inspire these young people to get into geriatric medicine, because it's hard work, and compared to cardiology or radiology or anesthesia, the young physician going into the field are less because of the debt that they incur through medical school, as well as the income that they're going to get as a geriatrician. There's a big difference. So how do we address that issue? And the grant is attempting to address this issue.
Okay. Dr. Lin, I think that would be one of the challenges that you face with providing health care for the elderly. What are some of the other challenges that you face?
Well, I think the challenges is because you have to work with a lot of disciplines, and you have to work with people in terms of healthcare professionals as well as caregivers and stuff, and there's a lot of education that needs to go into it, and it's very, sometimes it can get complicated. So the challenge is getting everybody on the same page of what the basic definition of a geriatric patients are, and what are the basic knowledge that the team needs to have. Okay.
Now, I know in this grant, HRSA grant, you have implemented something called LIGHT, L-I-G-H-T. What does that stand for, and exactly what is LIGHT?
So it stands for Lake Erie Integrated Health Team, okay? And the reason why it's called LIGHT, or we came up with that, is that the grant calls for us to not only work with the disciplines within our institution, LECOM, but it also calls for partnering with our community educational entities. So, right here in northwestern Pennsylvania, Erie, Pennsylvania, we have great institutions such as Gannett University, Mercyhurst University, and Embro University,
Right.
Penn State, Barron. They all came together, and we invited them to participate in this grant because they have nursing programs and therapy programs, and that help complement the entire grant. Because what we're trying to establish with this grant is to work together as a community with all the educational leaders, experts in geriatrics, and come up with a standardized curriculum for each individual discipline. So, for example, here at LECOM, we're working on creating a curriculum for medical students for in preclinical education and also clinical education, and then we have the opportunity to develop a curriculum all the way through to postgraduate training such as internship, family medicine residency, internal medicine residency, as well as the geriatric fellowship that we have developed at LECOM. And then nursing, for example, Gannett, Mercyhurst, and Embro, we're working with them so that we can agree upon a standard curriculum to what are the basic goals and objectives that a nursing curriculum should look like that would address, in helping develop the young students in taking care of the elderly.
Okay, so we are on the ground floor with this healthcare training. What are the end result, aims, and goals of Light?
So the biggest goal that we have is to how do we affect and train the upcoming young generations in the knowledge of geriatric medicine. And the grant calls for that. At the end of the grant, we should be able to train upwards of 7,000 individuals that would get exposed to our geriatric curriculum that the entire team is putting together. That includes all the partners that we talked about. The other goal, that's the educational part. The other goal is, as you may know, recently LifeWorks of Erie has come under LECOM. It's actually now become an arm of our geriatric service line or senior service line. And it's a very important part of our continuum of care, because what the services of LifeWorks, what they do is they provide a lot of educational activities for the members in the community, as well as they're the biggest provider for preventive health. So annually they give over 10,000 vaccinations to people around the community. So one of the goals is, in order to optimize your function and keep the quality of life, you have to be able to educate at the community level and affect the preventive health part. So a big part of the grant is that LifeWorks will be doing their part in terms of educating, in the community, both Erie County, and they go all the way out to Crawford County and Warren, to effectively give presentations on chronic disease management, fall prevention, as well as vaccinations.
Right. That's interesting, because sitting here talking to you right away, we just think of Erie County, but you guys are reaching out to all of Northwest Pennsylvania, aren't you?
Correct.
I find that wonderful, marvelous. Now, I know you're talking about 7,000 healthcare workers. What is the main importance of training 7,000 workers?
Well, we know that we're way behind in terms of getting geriatric experts into the field of medicine.
Okay.
Because right now, by the year 2030, I just mentioned over 75 million Americans over the age of 65, but there are only going to be about 30 to 40,000 fellowship-trained geriatricians to take care of 75 million Americans over the age of 65. And geriatric psychiatry is even less, only 7,500 individuals roughly are going to be fellowship trained.
Okay.
So we know we're never going to catch up. So one of the ideas would be anybody who's going through their basic training in healthcare should have a basic knowledge of how to approach a geriatric patient and how to identify the basic geriatric syndromes and stuff. So with these curriculum that we're trying to create, it's really to effectively disseminate or transfer knowledge of basic geriatric medicine to as many people as we can at the basic level, and then as they develop in their training and stuff, they can get exposure to taking care of the elderly, so that hopefully they could identify some of the red flags that would cause them to have functional decline or decrease their quality of life, and they can refer to the appropriate geriatricians in their community or to work with geriatric professionals in their community.
So, Doctor, the LIGHT program is going above and beyond the other training programs that are in place right now?
Correct. Because right now the focus, if you look at a lot of the institution, right now the focus, it's just recently every educational entity that are in healthcare professions, they're talking about interprofessional training. But prior to the last few years, that really wasn't talked about. It was very siloed. If you're a nurse, if you're a therapist, if you are a doctor, you just do your discipline, and there's not this interprofessional training. And they have recognized that this is very important in taking care of the elderly because of the coordination of care that's required and the complexity of taking care of individuals. So it's a relatively new thing, and I think you're going to continue to see that as years come, as we go on.
Okay. Now, actually, Doctor, what makes LECOM Institute for Successful Aging uniquely prepared for this program?
Well, I think the last 7 years, the Institute of Successful Aging has taken the lead in developing clinical services. So we're the first health system that has an acute care of the elderly unit for acute hospital.
Okay.
So we're the first that has a continuous continuum of care where we have our post-acute care units within the hospital, as well as a connection to a long-term care. And this makes it unique because an individual, as you can imagine, now they can see the progression of an individual and follow the patient from a well individual in the community all the way through illness, acute illness, all the way through rehab, and all the way back home. So it's the complete continuum that is very unique, that if you were a nurse student or medical student not within LECOM campus, you may have to experience this at a different time, and it's always maybe 4 weeks of skilled nursing, 4 weeks of acute care, rather than this idea that we can bring the students in and they could follow the patients through the different level of services and stuff. And it's very important for them to get that perspective, because they get appreciation for how complex it is to really follow the patient through for different various level of care.
And you're right, that is very important, because I'm personally going through this with my mother, who is going to be 92. So unless somebody has really been invested and involved in watching this progression of health issues.
Right.
And you're right, it takes a village. Right. For one senior.
Correct.
When you're talking about their health care, because there's so many entities involved. You guys really have you pretty much covered everything there.
Yes, we try, and that was the goal, and I think we've been very successful in doing that, and I think it's really an added resource to the community, and that's what LECOM is all about.
Yes,
we wanted to have to be the experts in taking care of the elderly, and to have the latest technologies and the campus to really provide the service that the community really needs.
Now, I want to talk just briefly, because our time's really kind of at the end, the Institute for Successful Aging. All right, say I'm 80 years old, I'm really not feeling well, or do I just come to you, to your offices, and you'll do an evaluation?
Yes.
And then you can direct what area
Absolutely.
You feel needs to be worked on?
Correct.
Is that how that works?
That's how that would work. So a lot of times we get the patients, they see us in the office, and we do what we call a comprehensive geriatric assessment.
Okay.
Okay. And a comprehensive geriatric assessment includes medical history, psychosocial history, and functional assessment. And once we get a full picture of your overall health, then we sort of look at what resources you need, and I often tell the patients that we map out a roadmap for you to get to your optimal health. So whatever you need, we give you a map so you can follow, and we have resources along the way. So for example, as far as I know, we're the only geriatric based practice in northwestern Pennsylvania in terms of the full complement of having a social worker in an outpatient setting, as well as a speech language pathologist, as well as a neuropsychologist and the neurologist and the podiatrist all in one area, so that really, if you think about all those disciplines, again, is an interprofessional, interdisciplinary team that will be able to create that map for an individual to wellness. And it's very important that we have that.
And this grant is going to help you expand this, and even what you have in place right now is just going to grow, correct?
Yeah, and the grant is to educate, hopefully more people get exposure to what we do, so that eventually if they were lucky enough to train with us, or we're lucky enough to have them, they could create another program somewhere else in the country, because it's much needed not just in northwestern Pennsylvania, but it's much needed everywhere else in the country.
You guys really have invested so much in geriatric health in this community. You really have. And again, who again do you partner with? Some of your different partners.
So we have, and I'm probably going to be missing a few, so I apologize ahead of time if I miss, but you know, the major university, like I mentioned, Gannett University, Mercyhurst University, Edinburgh University, Penn State University, Barron, as well as Alzheimer's organization, LifeWorks of Erie is one of our entities now, and also Meals on Wheels, and Rotary Club, believe it or not, because we want to be able, they have a program that they go out and inspire young people in high school level and want to attract them into healthcare. And if we attract them into healthcare, we want them to hopefully get into the geriatric medicine.
Okay. This is great. I am so excited that you guys received this grant. And I'm very impressed too, because like you said, you're right in there with Johns Hopkins, with Yale. You know, kudos. You guys do a fantastic job for our community, especially with me working at Millcreek, and I do work with seniors. I do get feedback of how, you know, successful and how pleased people are when they do come to the Institute of Successful Aging. You guys do a great job.
Good to hear. Thank you.
Yes. Now, Doctor, if anyone wants to know a little bit more about the Institute, or even a little more about this grant and maybe how it can affect them or how they can help or participate, who should they contact?
Well, they could call our office, 868-3488. That's my Institute of Successful Aging office. That's our Institute of Successful Aging office. And somebody can help them with that if they need any services and so forth. For the LIGHT grant, some of the information will be at the LECOM website, so lecomhealth.com. You can go in there and you can navigate and find that. And we're currently working on a LIGHT-specific web portal.
Okay.
And it's going to take at least 6 to 12 months for us to build the site, but eventually, at the end of 3 years of our funding period, it's going to be a resource site for the community as well as healthcare professionals. Any educational program that we develop through the LIGHT program will be posted onto that portal. So if you're a healthcare professional, you can sign up. There might be educational lectures and stuff that they could find. If you're a caregiver and community member, there will be community calendar events on education, for fall prevention, for memory assessment and things like that, that a community member would be able to access. So at the end of 3 years, that would be a very comprehensive thing, but it should be operational in the next 6 to 12 months with that website. Well,
Doctor, I want to thank you so much for joining us on the program today. And I also want to thank you because of my age and I'm getting pretty darn close there too. So thank you for everything that you're doing for the community. I do appreciate it. I know you're a very busy guy, but I know our viewers would want to know about what's new with LECOM in the community. So again, thank you so much.
Well, thank you for having me, and there's more to come, so stay tuned.
Okay, you heard it here first. Any questions? Give them a call, check out the website. Viewers, thank you so much for tuning into the Millcreek Government Channel. Until next time, have a wonderful day.
You're watching the Millcreek Government Channel, powered by WQLN Public Media.